Hello and welcome to Fighting COVID with me, Antra Bose. In this segment, we give you the latest international COVID updates and also a recap of what's happening locally. In some international news, Germany has issued what appears to be the strongest recommendation anywhere for the mixing of COVID-19 vaccines on efficacy grounds. The German Standing Committee on Vaccination said on Thursday that people who receive a first dose of the Oxford-AstraZeneca vaccine should get an mRNA vaccine as their second dose, regardless of their age. This makes Germany one of the first countries to strongly recommend that people who have received a first dose of AstraZeneca receive either a Pfizer-BioNTech or Moderna vaccine as their second dose. German Chancellor Angela Merkel helped pave the way for mixed vaccine use when she received the Moderna shot in June as her second dose following a first dose of the AstraZeneca vaccine. STIKO said that current study results show that the immune response generated after a mixed-dose vaccination is clearly superior. The mRNA vaccine currently approved by the European Medicines Agency are Pfizer-BioNTech and Moderna. Canada's National Advisory Committee on Immunization made a weaker recommendation on June 17th when they said that an mRNA vaccine is now preferred as the second dose for individuals who have received a first dose of AstraZeneca or the Covishield vaccine. The Canadian committee said it was making the recommendation based on emerging evidence of a potentially better immune response from this mixed vaccine schedule. A study carried out by researchers at the University of Oxford and published on June 28th found that alternating doses of the Oxford-AstraZeneca and Pfizer-BioNTech vaccines generate robust immune responses against COVID-19. According to a University of Oxford press release, the paper found that both mixed schedules, Pfizer-BioNTech followed by Oxford-AstraZeneca and Oxford-AstraZeneca followed by Pfizer-BioNTech, induced high concentration of antibodies against the SARS-CoV-2 spike IgG protein when doses were administered 4 weeks apart. The EMA said in a press briefing on Thursday that although they are not in a position to make any definitive recommendation on the use of different COVID-19 vaccines for the two doses, there is a strong scientific rationale behind the approach. Marco Cavalieri, head of biological health threats and vaccine strategy for the EMA, told the briefing that the agency is aware of the preliminary results from studies conducted in Spain and Germany that show that this strategy achieves satisfactory immune response and no safety concerns. Also making reference to the recent Oxford data, Cavalieri said that EMA would continue to review the data as it becomes available. Meanwhile, the World Health Organization officials concerned about easing of precautions meant to stop the spread of the coronavirus, even as the most contagious variant to date has emerged, have urged even fully vaccinated people to continue wearing masks and to keep taking other measures to prevent the infection. The Centers for Disease Control and Prevention, on the other hand, told fully vaccinated Americans in May that they no longer needed to wear masks indoors or to maintain a distance of 6 feet from other people. The agency also eased advice about testing and quarantine after suspected exposure to the virus. Asked about the new cautions expressed by the WHO, the world's largest public health organization, a CDC spokesman pointed to the existing guidance and gave no indication that it would change. A highly infectious form of the virus called the Delta variant was first detected in India and has been identified in at least 85 countries. In the United States, where its prevalence has doubled in the last 2 weeks, the variant is responsible for 1 in every 5 COVID-19 cases. Dr. Anthony Fauci, the nation's top infectious disease doctor, has called it the greatest threat to eliminating the virus in the United States. Dr. Mariangela Simao, the WHO's Assistant Director General for Access to Medicines, Vaccines and Pharmaceuticals, emphasized at the briefing that even vaccinated people should continue to consistently wear masks, avoid crowds and maintain social distance from others, make sure they are in well-ventilated places, wash hands frequently, and avoid sneezing or coughing around other people. The comments were made in the context of broader statements criticizing the inequitable distribution of vaccines around the globe and the lack of access to vaccination in many parts of the world where the virus is still spreading. Now talking about wearing masks, a new research finds that mask upgrades can cut infection risks. The quality of face masks healthcare workers wear makes a huge difference to their risk of coronavirus infection, Cambridge University Hospital's NHS Foundation Trust research has found. Wearing a high-grade mask known as an FFP3 can provide up to 100% protection. By contrast, there is a far greater chance of staff wearing standard-issue surgical masks catching the virus. Professional bodies have long campaigned for staff to be given better personal protective equipment. The data was gathered during a program of regular testing for COVID at the Trust. The results are published in a preprint paper that has not yet been peer-reviewed. For most of last year, the hospital followed national guidance which specifies that healthcare workers should wear surgical masks except in a few limited situations. Though fluid-resistant, these masks are relatively flimsy and loose-fitting and are not meant to screen out infectious aerosols, tiny virus particles that can linger in the air and are now widely accepted as a source of coronavirus infection. The study found that staff caring for COVID patients on red wards faced a risk that was up to 47 times higher than those on green or non-COVID wards. Lead researcher Dr. Mark Ferris, a specialist in occupational health at the hospital, said staff were getting COVID despite doing everything they were asked to in terms of infection control. So as the second wave of the pandemic started to hit last December, managers in Cambridge made a local decision to upgrade the protection on red wards. The only thing left to try that could make a difference was FFP3 respirators, and they did, Dr. Ferris said. FFP3 masks have a close fit and are specifically designed to filter out aerosols. Those are a few of the international updates. We'll take a short break and we'll be back with the local news.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID. Now for a quick recap of what's happening locally. The Ministry of Health has clarified in a publication that there are specific cases that require medical intervention when a child is infected with COVID-19 disease, including the following symptoms: difficulty breathing and high temperature, chest pain, color of the lips and face changing to blue, severe abdomen pain, persistent diarrhea and or vomiting, inability to wake up, insomnia, difficulty concentrating or sluggishness. Meanwhile, Oman has announced a new target group for vaccines that started yesterday. People aged 18 years and above are receiving the first dose of the COVID-19 vaccine only, and the second dose will be announced in the coming period, said the Director General of Health Services in Al-Dhahira Governorate. With the rising number of deaths in Oman, doctors in Oman highlighted four main reasons behind COVID-19 deaths in Oman: a person's natural immunity, the strain of the virus that has infected them, the extent to which the virus has spread in their body, and any other existing health problems they have influence whether they will make a full recovery or succumb to the disease. Doctors also said that immunity, a person's natural ability to fight off disease, is by far the most important factor in combating the coronavirus, and the factors that determine this are often hereditary. However, following a proper diet and taking regular exercise are two of the best ways to naturally boost the body's disease-fighting capabilities. On that note, let's focus on holistic well-being and fight COVID together. We'll be back with more updates, so stay tuned and keep watching TTV.